Welcome to today's video about symptoms of high creatinine levels. Have you ever wondered what that creatinine number on your blood test means? Could it be a silent signal your body is sending? You're not alone. Approximately 11 to 13% of the global population is affected by chronic kidney disease, often linked to high creatinine levels. But what exactly is creatinine, and why should you care? Creatinine is a waste product produced by our muscles during regular activity. Normally, our kidneys filter it out, keeping our system in balance. But when our kidneys can't keep up, creatinine accumulates. This buildup isn't just a number on a lab report, it can be a warning sign of underlying issues. Could unexplained fatigue or shortness of breath be more than just everyday stress? What about swelling in your legs or changes in urination? Recognizing these subtle symptoms early can make all the difference. Stay with us as we uncover the signs of elevated creatinine levels and empower you with knowledge to take charge of your health. Your health journey is personal. Let's navigate it together. Please note, this video is for informational purposes only and is not a replacement for professional medical advice, diagnosis, or treatment. Always consult a healthcare provider for any medical concerns. All research information shared here has been verified by researchers. You can find all references to the studies mentioned in the description below. Now, let's break down the symptoms of high creatinine levels, beginning with number 1 on the list. Fatigue and weakness. When your kidneys aren't working properly, waste products like creatinine can build up in your blood. This accumulation can make you feel unusually tired and weak. Essentially, your body is carrying around extra waste it can't get rid of, which can sap your energy. A study in the Clinical Journal of the American Society of Nephrology found that about 70% of people with chronic kidney disease experience fatigue, with up to 25% reporting severe symptoms. This shows how common and impactful this tiredness can be. Additionally, when kidneys fail to filter properly, toxins accumulate in the blood, leading to a condition called uremia. This can cause symptoms like fatigue, weakness, and confusion. If you're feeling persistently tired and weak, it's essential to consult a healthcare professional. They can perform tests to check your kidney function and determine if high creatinine levels are the cause. Early detection and management are crucial in preventing further complications. Next, number 2. Swelling. Imagine waking up to find your shoes fitting tighter than usual, or noticing puffiness around your ankles. This swelling, known as edema, can be more than just a minor inconvenience. It might signal elevated creatinine levels, indicating kidney issues. When kidneys struggle, they can't efficiently remove excess sodium and water from your body. This retention leads to fluid accumulating in tissues, causing noticeable swelling, especially in areas like the legs, ankles, and face. This isn't just about appearance, it's your body's way of signaling that something's amiss with your kidney function. A study published in the Curious in 2022 highlighted that individuals with chronic kidney disease often experience edema due to this sodium and water retention. The research emphasized that managing salt intake and monitoring fluid balance are crucial steps in alleviating this swelling and preventing further complications. Beyond the visible puffiness, edema can lead to discomfort and mobility issues. Simple activities like walking or wearing regular footwear might become challenging. Moreover, if fluid accumulates in the lungs, a condition known as pulmonary edema, it can result in breathing difficulties, making daily tasks daunting. It's essential to pay attention to these signs. If you notice persistent swelling, especially when accompanied by other symptoms like fatigue or changes in urination, consulting a healthcare professional is vital. Early detection and management can make a significant difference in maintaining your health and quality of life. Next, number 3. Decreased urine output. When our kidneys aren't filtering blood effectively, waste products like creatinine accumulate, leading to decreased urine output, or oliguria. This reduction in urine production is often one of the earliest signs of kidney dysfunction. As the kidney's filtering capacity declines, less urine is produced, causing fluids and waste to build up in the body. A study published in the Nature Reviews Disease Primers in 2021 highlighted that patients with acute kidney injury, or AKI, frequently present with oliguria, and this symptom is associated with higher serum creatinine levels. The research emphasized that monitoring urine output is crucial for early detection and management of AKI. If you notice a significant decrease in your urine output, it's essential to consult a healthcare professional promptly. Early intervention can help address potential kidney issues before they progress to more severe stages. Next, number 4. Shortness of breath. Kidneys play a crucial role in filtering waste, but when they lose efficiency, toxins like creatinine start building up in the blood. This buildup often leads to fluid retention, as the kidneys struggle to balance fluid levels. Excess fluid can accumulate in various parts of the body, including the lungs, a condition known as pulmonary edema. This fluid in the lungs makes it challenging to breathe, resulting in shortness of breath. A 2023 study published in the Physical Activity and Nutrition examined the relationship between kidney function and lung health. The researchers found that individuals with elevated serum creatinine levels had a higher likelihood of experiencing restrictive and obstructive pulmonary conditions, both of which can manifest as breathing difficulties. Furthermore, impaired kidney function can lead to anemia, a deficiency in red blood cells responsible for transporting oxygen throughout the body. With fewer red blood cells, oxygen delivery decreases, causing symptoms like fatigue and shortness of breath. This means that even routine activities can become exhausting as the body struggles to meet its oxygen demands. If you're noticing unexplained shortness of breath, especially alongside other signs like swelling or fatigue, it's essential to consult a healthcare professional. These symptoms could indicate underlying kidney issues that need prompt attention. Next, number 5. Nausea and vomiting. High creatinine levels often signal impaired kidney function, leading to the accumulation of waste products in the body, a condition known as uremia. This buildup can directly irritate the gastrointestinal tract, resulting in symptoms like nausea and vomiting. Additionally, electrolyte imbalances, such as elevated potassium levels, can further exacerbate these digestive issues. A 2022 study published in Kidney International Reports highlighted that patients with significantly reduced kidney function often present with nausea and vomiting. These symptoms are closely associated with elevated urea levels, underscoring the direct impact of accumulated waste products on the gastrointestinal system. It's essential to recognize that persistent nausea and vomiting in the context of high creatinine levels may indicate worsening kidney function. If you're experiencing these symptoms, it's crucial to consult a healthcare professional for appropriate evaluation and management. Next, number 6. Muscle cramps and twitching. Muscle cramps and twitching can be linked to elevated creatinine levels, primarily due to impaired kidney function. When kidneys aren't filtering waste effectively, electrolytes like potassium and calcium can become imbalanced. These imbalances often lead to involuntary muscle contractions and spasms. A study in Nephrologia, 2016, found that patients with high creatinine levels experienced frequent muscle cramps. The research highlighted that these cramps were directly associated with disrupted calcium regulation, emphasizing the critical role of electrolyte balance in muscle function. If you're noticing persistent muscle cramps alongside elevated creatinine levels, it's essential to consult a healthcare professional. They can assess your kidney function and recommend appropriate interventions to manage both the cramps and the underlying cause. Next, number 7. High blood pressure. Elevated creatinine levels often signal impaired kidney function, which can lead to high blood pressure, hypertension. When kidneys aren't filtering blood efficiently, excess fluid and sodium accumulate in the bloodstream. This increase in fluid volume raises blood pressure. Additionally, compromised kidneys may overactivate the renin-angiotensin-aldosterone system, or ERAAS, a hormonal pathway that regulates blood pressure. Overactivation of RAAS causes blood vessels to constrict and prompts the body to retain sodium and water, further elevating blood pressure. A study published in the Journal of Hypertension in 2022 found that higher plasma creatinine concentrations are associated with an increased risk of developing hypertension in men. This underscores the link between kidney function and blood pressure regulation. In summary, elevated creatinine levels can indicate kidney dysfunction, leading to fluid retention and hormonal imbalances that raise blood pressure. Recognizing this connection is vital for early intervention and effective management of both kidney health and hypertension. Next, number 8. Persistent itching. Persistent itching, medically known as pruritus, is a common symptom among individuals with elevated creatinine levels, often indicating compromised kidney function. This itching, referred to as uremic pruritus, can significantly impact one's quality of life. Why does this itching occur? When kidneys aren't functioning properly, waste products like urea accumulate in the blood, a condition termed uremia. This buildup is believed to trigger itching sensations. Additionally, imbalances in electrolytes, such as increased phosphorus levels, can exacerbate the itchiness. Dry skin, common in kidney disease patients due to reduced sweat and oil gland activity, further contributes to the discomfort. Recent research has shed light on this issue. A study published in the Clinical Kidney Journal in 2023 highlighted that up to 70% of dialysis patients experience pruritus, underscoring its prevalence and the need for effective management strategies. Understanding the connection between high creatinine levels and persistent itching emphasizes the importance of monitoring kidney health and seeking appropriate care to manage symptoms effectively. Next, number 9. Loss of appetite and weight loss. Metabolic disruptions create a complex cascade of physiological changes when creatinine levels escalate beyond normal ranges. Your body becomes an intricate warning system, signaling distress through nuanced symptoms like diminished appetite and unexpected weight loss. Kidney function plays a pivotal role in this metabolic mystery. The Nephrology Dialysis Transplantation, 2015, revealed that elevated creatinine levels trigger pro-inflammatory cytokines, which dramatically suppress appetite-regulating hormones. These molecular mechanisms demonstrate how metabolic stress disrupts ghrelin and leptin, crucial hormones controlling hunger signals. Protein catabolism accelerates, causing muscle tissue breakdown and consequent unintentional weight reduction. This metabolic recalibration represents your body's sophisticated survival strategy during compromised kidney function. Biochemical investigations highlight how accumulated waste products interfere with digestive enzyme production, creating an environment where nutrient absorption becomes challenging. Metabolic disturbances manifest through complex neuroendocrine pathways. The hypothalamic-pituitary-adrenal axis becomes dysregulated, creating neurochemical imbalances that directly suppress appetite centers in the brain. These symptoms aren't mere coincidences, but sophisticated biological responses, signaling underlying renal challenges, urging immediate medical attention and comprehensive diagnostic evaluation. Your body communicates through these nuanced metabolic alterations, demanding careful interpretation and professional medical insight. Next, number 10. Headaches. Neurological complications emerge as silent messengers when kidney function deteriorates. High creatinine levels trigger a cascade of metabolic disruptions that directly impact brain chemistry, manifesting as persistent headaches. Groundbreaking research from the clinical pharmacology and therapeutics reveals that elevated creatinine concentrations create neurotoxic environments. Accumulated waste products interfere with neural signaling, causing inflammatory responses that stimulate pain receptors in the cerebral cortex. Metabolic imbalances associated with compromised kidney function disrupt electrolyte homeostasis. Sodium and potassium levels become destabilized, generating neurological strain that directly contributes to vascular tension and consequent headache manifestations. These biochemical alterations create intricate neurological stress mechanisms. Inflammatory cytokines released during kidney dysfunction penetrate the blood-brain barrier, triggering neuroinflammatory responses. This complex physiological mechanism explains why individuals experiencing high creatinine levels often report recurrent, intense headaches that resist traditional pain management strategies. The body's sophisticated communication system transforms headaches into critical warning signals, demanding comprehensive medical evaluation and immediate intervention to address underlying kidney dysfunction. Next, number 11. Metallic taste in mouth and bad breath. Elevated creatinine levels often signal impaired kidney function, leading to the accumulation of waste products in the blood, a condition known as uremia. This buildup can manifest as a metallic taste in the mouth and bad breath. When kidneys aren't filtering efficiently, urea accumulates and breaks down into ammonia, imparting an unpleasant taste and odor. A study published in the Journal of Renal Nutrition in 2024 highlighted that approximately 35% of end-stage renal disease patients experience dysgeusia, or altered taste perception. This alteration often leads to decreased appetite and nutritional challenges. Additionally, research indicates that elevated salivary levels of creatinine and urea in chronic kidney disease patients can contribute to dry mouth and uremic breath. These changes further exacerbate the metallic taste and bad breath associated with high creatinine levels. It's essential to recognize these oral symptoms as potential indicators of declining kidney function. If you're experiencing a persistent metallic taste or bad breath, consulting a healthcare professional is advisable to assess kidney health and address any underlying issues. Next, number 12. Trouble sleeping. Experiencing trouble sleeping can be a symptom of elevated creatinine levels, often indicating compromised kidney function. When kidneys aren't filtering waste effectively, toxins accumulate in the blood, leading to discomfort and sleep disturbances. This buildup can result in symptoms like muscle cramps, restless leg syndrome, and itching, all of which interfere with a restful night's sleep. A 2024 study published in Renal Failure found that insomnia and short sleep duration increase the risk of elevated serum creatinine. This suggests a bidirectional relationship where poor sleep can both result from and contribute to declining kidney function. Additionally, sleep apnea is more prevalent among individuals with chronic kidney disease. The frequent interruptions in breathing characteristic of sleep apnea can lead to fragmented sleep and reduced oxygen levels, further straining kidney function. Addressing sleep issues is crucial, as improving sleep quality may help in managing elevated creatinine levels and overall kidney health. Next, number 13. Chest pain and heart palpitations. It starts as a small discomfort, maybe a tightness in your chest or an unusual flutter in your heartbeat. You brush it off, thinking it's just stress or too much caffeine. But then it happens again. And again. What if the real reason is something you wouldn't expect? Your kidneys. High creatinine levels, A sign of kidney trouble can silently strain your heart. When the kidneys aren't filtering waste properly, excess fluid builds up in the body, putting pressure on the heart. At the same time, imbalanced electrolytes, like potassium and sodium, can disrupt the heart's rhythm, leading to palpitations or even chest pain. It's not just about the kidneys. Your whole body feels the impact. A study published in the Journal of the American Society of Nephrology found that even slight increases in serum creatinine levels are linked to a higher risk of cardiovascular events, including heart attacks and strokes. This highlights the deep connection between kidney function and heart health. If you've noticed these symptoms along with high creatinine levels, don't ignore them. Your body is signaling that something needs attention. A doctor can check both your kidney and heart health to get to the root of the problem. And that's a wrap for today. Now, you know the symptoms of high creatinine levels and why it matters. If you've found this video helpful, type "helpful" in the comments. It lets us know you're gaining value and motivates us to create more content like this. Remember, your health is in your hands. The sooner you spot the signs, the better your chances of taking action. Don't forget to like, share, and subscribe so you never miss a crucial health update. Take care, stay informed, and we'll see you in the next video.